For prescribing the medicines, we are varying the dose according to the age, according to the gender. We are varying the dose. And what about the radiation dose? You are varying the dose for the children or for pregnant women?
First of all, pediatric patient, we have to reduce the dose. It is for patient protection, radiation safety aspect only. So, if patient thickness body is less, so I can produce a image, high quality image with a low dose. Okay, first thing. So, second thing is pediatric patients are radio sensitive in nature, so that they are in developing phase. If you interact with the radiation, there causes cell mutation, cell division. Due to that, they will have a abnormality. Because of that, we have to reduce the patient dose.
Okay, and sir, what about the pregnancy?
Actually, for pregnant ladies, we should not expose at all. Now, if it comes to like it's compulsory to expose the patient. We should take all the preventive measures. Like, for example, if the patient, the pregnant lady has needed, he had a fracture, he had an accident, and he had a fracture in her hand. Okay, so what we'll do, we'll protect her entire body except her hand. Okay, we'll protect her, and we have the lead shieldings, we have lead aprons, we have thyroid shields and other lead capes, lead goggles, so we'll protect her entirely. So what we need is, we need an hand x-ray of that patient, that too when a doctor or the department head recommends that x-ray. Actually, if a pregnant lady comes to your department, immediately you should inform to the in charge, to the head of the department, and you should dispatch that patient from the department if it's like for common x-rays. But if it is an emergency, like the patient had an accident or patient had a fall, and patient is having a fracture in her hand or in her lower limbs, so now we need to expose. To rule out the fracture, we need to expose. We have to see the fracture, and maybe patient will undergo surgery or any other procedure. So then what we will do, if if a hand x-ray is required for the pregnant lady, so what we will do, we will only expose hand, that we are commonly doing. Rest of the parts will cover with lead equipments, and we will follow some rules also, especially followed for all every time. We'll follow in this we'll follow that ARB regulations. Okay, we will keep the dose as low as minimum, means we'll minimize the dose. For example, if commonly we are giving a factor, like we have KVP and MES factors in that, if we are commonly giving 60 or 55 and 8 for hand, we will reduce it. We'll reduce it little more. Even though we will not get good quality images or better quality images, we will reduce it. We'll just while processing, we will try to adjust the contrast nicely. But here we will reduce. And another thing is, we'll cover her entire body except the anatomy which is required for the X-ray. Okay, so first of all, I again come to the point. For pregnant ladies, we should not give the exposure. In case of emergency and all, we should take all the preventive measures for her. Okay, so that the baby who is growing inside should be safe from mutations or from other harmful.
I will also state,
Yes, sir.
generally people will have a afraid when pregnancy is there, they can undergo x-ray examination or not. So that time in first trimester, there are high risk possibilities are there. In first trimester, compulsory they should not undergo any examination. 5 trimester, because that is the development stage, that cell division, everything will takes place. When radiation, primary radiation interact with that, definitely that patient baby will have a anomalies. Okay, so even when it comes to second and trimester, they want to undergo any radiation examination apart from the abdominal area. So as Momin said, so we can undergo with a basic protection, everything as a following. Okay, so and always we have to assess that benefit versus risk factor. Okay, so when mother is in risk stage, so we should undergo compulsory examination. Okay, as well as, so when baby, that time baby is not important, patient life is important, so that time definitely we can undergo for the procedures. So this is what I can state.
Means basically in pregnancy, unless until there is no any really the emergency, we should avoid.
So we should avoid the radiation. Alternative things are there, they can go undergo ultrasound examination, they can undergo MRI examination. MRI examination also risk factors are there. There the children will, because MRI will be having a heavy noise inside the MRI. So nowadays we have a silent MRI, they can opt that and they can go. So if generally there is a fracture in finger, hand, like that, means as Momin said, we can undergo examination by taking care of proper precaution.